Hello everyone, myself Bhagya, a student of College of Agriculture, Vijaypur, under the University of Agricultural Sciences, Dharwad, under the guidance of S.Y. Mukherjee sir, Head and Assistant Professor of Department of Animal Science, College of Agriculture, Vijaypur. I will represent my topic, enteritis. Enteritis. It's an inflammation of small intestinal mucosa leading to diarrhea and dysentery. As its name itself suggests, it's a small intestine and inflammation. Etiology means study of its causal agents. Infectious enteritis caused by bacteria like E. coli, Salmonella, and virus. Example: rinderpest. Parasites. Example: nematodes, cystodes, and trematodes. By food like poisoning and mycotoxins, and management practices like poor sanitization. Regional enteritis. Ischemic enteritis, which is due to blood flow. Radiational enteritis, which is due to small intestine after the radiation therapy. It's also used for treatment of cancer. Let's see signs and symptoms. Here of enteritis, these symptoms are highly variable and vary based on specific causes and other factors such as individual variants and stage of disease. Means they are dependent on these factors. Let's see symptoms. Those are abdominal pain, diarrhea, nausea, vomiting, dehydration, fever, pain, bleeding, mucus discharge from rectum. There are types of enteritis. There are two types. First one is acute enteritis and chronic enteritis. In acute enteritis, we can see four types. First one is catarrhal, second one is fibrinous, third one is purulent, fourth one is ulcerative. In chronic enteritis, we can see three types. First one is hemorrhagic, and second one is necrotic, and third one is granulous. Let's see acute enteritis. Acute inflammation of small intestine. Etiology. Many infections such as typhoid you can see. Elementary toxication. Example: salmonellosis and botulism. And poisoning also causes acute enteritis, and other is allergy. First one is catarrhal enteritis. We can see catarrhal enteritis photo here, and it's a mucous membrane is hypermic and covered by serous mucus, serous purulent fluid. Inflammatory process occurs in mucus and submucosal layers. It's a catarrhal enteritis photo. You can watch here. And second type is fibrinous enteritis. It's a mucosa of intestine is necrotized. Occurs by accumulation of fibrinous exudates. Let's see its photo. It's a fibrinous enteritis. Purulent enteritis. It's characterized by diffuse infiltration of intestinal walls by pus and formation of pustules, especially at the place of lymphatic follicles. Fourth one is ulcerative enteritis. It's a destruction process which occurs at lymphatic follicles. There are complications in this acute enteritis, which are bleeding, perforation of intestinal wall, dehydration, demineralization, acute may convert into chronic form. It's main important, which is converted from acute to chronic form. Let's see some photos of ulcerative enteritis, fibrinous enteritis, and chronic enteritis. Second type, chronic enteritis. It's the chronic inflammation of small intestine. It may be hemorrhagic, necrotic, or granulomatous. These are types of chronic enteritis. Complications here we can see are dehydration, excessive thirst, weakness, fatigue, and urine is in dark color, dizziness. These are some complications which we can see in chronic enteritis. These are photos of hemorrhagic enteritis, which we can see where it's in red color, and granulomatous enteritis, necrotic enteritis where the tissue is dead. And treatment which we can make for enteritis are, we should use antibiotics such as Norflax tablets or Flux tablet and Diarolin plus 3K. This is Orflax tablet, which can be used as antibiotic in enteritis treatment. And this is Orflax tablet. It's an antibiotic which is used in enteritis. And antispasmodics like dicyclomine, loperamide. This is dicyclomide HCl tablets. This is fenbendazole tablets used for treatment of enteritis. And deworming drug, which is fenbendazole, you've seen last one, and powder form of Neblon, which is used for treatment of enteritis. It's the Neblon used for enteritis treatment. These are used for treating enteritis.